Hello, I'm Dr. Helane Fronek, and it's a pleasure to be talking today to Mr. Bruce Sanders, the Executive Director of the American College of Phlebology. Bruce, we've known each other for a really long time.
We have.
We have. And I remember when you first came on as Executive Director of the American College of Phlebology. How many members did we have back then?
You know, Helane, at that time we had around 250 members.
And how many do we have now?
We're just short of 2,000.
Wow, what an extraordinary change.
It's been huge, and the interesting thing about, I think, about the changes is that when I first got involved with the college, the membership was only physicians. But today we include physicians, nurses, ultrasound technicians, advanced practice nurses, and PAs.
I think that really mirrors what's happening in medicine all across the country, that taking care of patients is becoming increasingly sort of a team effort where everybody brings their own background and expertise and contributes that to the care of the patient.
Absolutely.
Yeah, it's interesting. Through the years, we learn so much from the ultrasound technologists. We learn so much from the nurses who have a very different experience with our patients than we as physicians do. Mm-hmm. So I think it really is a testimonial to the American College of Phlebology that they have made that change.
Very much so. And Helene, it really does focus in on good patient care, because it takes that team to take care of the patient, right, and to really see and share the different perspectives that they all bring to that table. And I think that's what's made our organization so dynamic.
I remember a long time ago, the college had a strategic planning session.
Yes.
And what was the mission and vision that was established?
Well, the mission and the vision is very simple: to advance vein care. Mm. And I think that mission has been very effective for the college.
So in what ways does the American College of Phlebology really serve patients?
Oh, wow, I'm glad you asked that, because there's so much the college is doing right now to really affect and improve patient care. We've established a number of different programs that I think facilitate that within the healthcare community, and one of them is we have research grants that we offer to members and non-members who really want to dive into learning more about venous disease and the different effects that the various treatments have, and again having good patient outcomes. So that's one aspect, and we're also doing a lot of work in the area of preceptorships and training, giving physicians opportunities to learn more about the various treatment modalities that are offered in phlebology.
That's pretty important, because at this point there is no residency training in phlebology.
Well, exactly, and I think that's one of the unique, I want to say, characteristics of the college is the membership's willingness to share their knowledge and to train each other, and to bring somebody in that comes from, say, a dermatology background or a vascular surgery background, general surgery. We've got family practitioners. We have just about every aspect of medicine that comes to this table.
We do.
And they love to share. And that's the fun part.
It is the fun part, and it's one of the more warm and welcoming organizations around, I think.
Absolutely.
Yeah.
There's very much a warm culture within the organization.
Right. Very collegial and very honest and open sharing at the meetings goes on.
Yes.
So that's how we're supporting and helping patients. What do we do for our members?
Well, our members have an opportunity on multiple levels. We have about 70 people, volunteers, who work on various levels of the organization on a volunteer basis, and working on anything from creating fellowship programs. That we have a great program started at NYU, training physicians on the full spectrum of phlebology and vein treatment. So we have a group of physicians that work on coding and reimbursement issues and proper medical coding of the treatments that they're doing. We also have committees that work on public education, to get the word out about vein disease and that there is a specialty available to treat them.
You know, that's a very important thing. A lot of physicians are not really aware of the incredible advances that have come about in this field. So I would say that that's a pretty important committee.
Well, exactly, and it's not just public education, it's also educating the medical community that this field is out there and that it's evolving and that there's a lot to learn and know about. And I think that's the other side that, and kind of digressing back and talking about what makes our culture so unique, is that physicians that have been out there practicing family medicine for a long time that have seen patients with varicose veins or spider veins, all of a sudden realizing, wow, there's a whole field out there devoted to this. And so it's a learning opportunity and gives them some new challenges within their field. So that's another aspect. So it's also educating the medical community that we exist.
Right. And then the American College of Phlebology holds a big meeting every year, don't we?
Yes, we do. We have an annual conference that attracts international attendees as well. So we have roughly in the neighborhood of 1,000 attendees that come in, and again from all levels of practitioners. So we have nurses and we have ultrasound techs, and they attend seminars and they listen to research being presented and have practical workshops on how to apply their newfound knowledge to actual patient care.
Wow. So it seems like there's something for everyone at the American College of Phlebology meeting.
There definitely is.
Bruce, you've been in this field now a long time, and I would like to say that the astronomical growth in the American College of Phlebology is due in large part to the enthusiasm and dedication of the volunteers, but I don't think that we would have been nearly as successful without your expert guidance.
Oh, well, thank you. And I attribute that, though, to working with very passionate, caring people. And when you're involved and you work with people that are this passionate, it really rubs off and it develops your passion and your excitement to be a part of that team that makes it. And so we really do work as a team. It's not one individual that makes this organization work. It is a whole team of people that make it work.
You know, I could not agree with you more. Thank you so much for coming and talking with us today.
Thank you for having me.
It's been a pleasure.
Likewise.